Medicare is a federal government entitlement program that funds health care for the elderly. It has three large separate parts for hospitals, physicians, and prescription drugs. The annual budget for the program is now about $550 billion, and it is expected to rapidly grow to more than $900 billion by 2020. This represents a staggering increase for a program that didn't even begin imposing costs on taxpayers until 1967. Trailing only national defense and Social Security, Medicare is the federal government's third most expensive program. The fiscal burden for Medicare is greater than the combined cost of federal spending on education, environment, transportation, veterans, commerce, employment, social services, and energy. If we do nothing, Medicare spending will turn America into a welfare state, especially when you add Medicaid, Obamacare, and other government health programs to the equation. Fortunately, there is a way to reform the program. In this Center for Freedom and Prosperity video, we're going to discuss a proposal that not only will be good for taxpayers, but one that also will improve the healthcare system and give senior citizens better value. I'm Dan Mitchell with the Cato Institute. To put it simply, the idea is to turn Medicare into vouchers, as proposed by experts such as my colleague Michael Cannon. Give every senior a big pile of money and then allow them to pick the insurance package that best reflects their needs. In one fell swoop, this would replace a clunky, one-size-fits-all government bureaucracy that distorts the healthcare system with a market-based approach that would give seniors better options and make the entire healthcare system function more efficiently. Congressman Paul Ryan, the chairman of the House Budget Committee, has incorporated this reform into his budget plan, and this proposal also is part of a broader entitlement reform plan he put together with Alice Rivlin, who served as director of the Office of Management and Budget during the Clinton administration. So there's already bipartisan support from people who care about the future of the nation. On the screen, let's look at a brief description of the Ryan-Rivlin proposal from the Congressional Budget Office. People who turn 65 in 2021 or later would not enroll in the current Medicare program, but instead would receive a voucher with which to purchase private health insurance. The amount of the voucher would be calculated by taking the average federal cost per Medicare enrollee and growing that amount at the annual rate of growth in GDP per capita plus 1 percentage point. There's a bit of jargon in that passage, but the key takeaway from a fiscal policy perspective is that overall spending would be constrained by the GDP formula. Now, I'd rather implement this reform right away, but the idea is that we don't change anything for current retirees or older workers. That's fair, though I'd want the opportunity to shift into the new system if I was older than 65 so I could control my healthcare choices. Now let's talk about why this reform would be good news for the overall healthcare system. We know that government programs such as Medicare are fiscal black holes, but the cost to taxpayers is just half the problem. The other part of the problem is that such programs are poorly designed. For all intents and purposes, programs like Medicare are akin to all-you-can-eat restaurants with someone else picking up the tab. And when people get to shop and consume with other people's money, that's a recipe for spiraling costs and dysfunctional markets. Not only excessive costs and widespread inefficiency, but also fraud, waste, and abuse. Politicians respond with various forms of central planning, regulations, and price controls, but it's a fool's errand to try and fix the problems caused by big government with even more government. This certainly isn't how capitalism works. Genuinely free markets are characterized by competitive prices resulting from consumers and producers directly interacting in the absence of significant government-created distortions. This is the case for most things we buy, such as cell phones, televisions, food, furniture, and shampoo. Unfortunately, politicians have largely divorced capitalism from healthcare, and that was true even before Obamacare. Thanks to government policies, an overwhelming share of healthcare expenses in America, 88%, are paid for someone other than the consumer, what is known as the third-party payer problem. Think about this for a minute. Would you be a cost-effective shopper if I told you that I would pay 88% of the cost the next time you buy a new car? Unless you're kidding yourself, the answer is no. But that crazy third-party payer system describes most of our healthcare system today. It's worth noting that in the few areas of the American healthcare system where our free market forces still operate, things such as cosmetic surgery and laser eye surgery, we find much better results. There is no cost explosion. Even abortion, whatever you think of it, is an example of how prices are constrained by market forces. When consumers are directly responsible for paying bills, costs don't go up. Let's wrap this up. Vouchers would simultaneously solve both of the big problems caused by Medicare. They would protect taxpayers by creating a limit on budgetary costs, and by giving beneficiaries control over their healthcare choices, they would help seniors and all other healthcare consumers by reducing the destructive impact of third-party payer on the healthcare system. Thank you for watching, and please help more people understand the issue by sending this Center for Freedom and Prosperity video to your friends and colleagues.